All right, we're going to talk about what an infection is now and the difference between a person who is sick with a disease who can pass the disease on, and then a person who might be a carrier of a disease and not even realize it. An infection is, or I should say, I won't say it that way. Infections can be subclinical. So if it's a subclinical infection, you don't have many symptoms. You may have no symptoms, but you can still be passing on a disease. If the infection becomes a disease, then you definitely have symptoms of some sort, be it pain, nausea, dizziness, tiredness. Those are all symptoms. Signs are things that you can actually measure. So things like a rash or a fever, pus formation, anything like that. An initial infection is the infection that you receive from, and I'm making this up, but you fall off a bike, scrape your leg, and you get an infection at that area. This can lead you to secondary infections. So now your immune system is compromised. It's fighting one thing. Now you're more likely to get another infection. So infections can be localized or systemic. A localized infection is going to be in one area. And so both of these infections that I'm showing you on this figure or on this slide are infections of the integument. So you can see right here, this large boil is localized to one region. This individual here, who has a very, very bad rash, this is found all over the body and likely is infecting other organs inside as well. So there are different stages of a disease. The initial stage of a disease is called the incubation period. This is when you first came in contact with a disease until you started having signs of a disease, or symptoms, not signs, symptoms of a disease. So example, chickenpox has about a week incubation period, where you initially, or not a week, I would say like 4 or 5 day incubation period, but where you came across someone who had chickenpox, maybe you knew, maybe you didn't know, and then a few days later you start having some of the same symptoms, maybe the runny nose, the cough, the slight fever, until you start showing all of the chickenpox all over your abdominal region, your back, going into your face and everything. And you're very infective at this time. And then this is going to lead to the decline phase where you start getting better, where the chickenpox starts to go away, you're starting to feel better, and then you go to the period of convalescence. Period of convalescence, typically you are healthy again, you're going back to good health. Sometimes you could still be spreading some of the pathogen though. And so this leads me to what a carrier is. A carrier is an individual that is carrying a pathogen and can infect other individuals with that pathogen. So you can have different types of carriers. You can have an active carrier. So if you're an active carrier, you have the disease. If you have the chickenpox and you go to the grocery store with the chickenpox, you are actively passing or spreading that disease. That's a bad thing. You wouldn't do that. A convalescent carrier is someone who has recovered from a disease but could still be harboring some pathogen. So think about you got over the cold, you're feeling a lot better. Maybe you still are coughing once or twice throughout the day. You're better, but you could still be passing on some of those rhinoviruses. A healthy carrier, these are the worst ones. The reason they're the worst ones is they don't even know they're sick. They don't know they're carrying. I shouldn't say they're not sick. They don't know they're carrying a pathogen. And so this leads us to this lady over here named Mary. What was her last name? Mary Mad. Oh, I can't think of her last name right now. I'm sorry. Um, Everybody knows her as Typhoid Mary. This is a YouTube video. It's actually a SciShow video. So I would click on it and watch it. It's amazing. Talks about Mary Malone's, I think that's her last name. But it talks about her life and how she was carrying typhoid bacteria. And she was actually causing illness in individuals. And she was put on an island by herself, basically. It's a really kind of crazy story. An incubatory carrier is someone who has the pathogen in them, but they don't even know it. They haven't found out that they're ill or that they're going to be ill because they don't have any signs or symptoms yet. So how do pathogens get into us? I mean, they have to be able to get into us to cause infection, right? Well, there are different routes that they're going to move through. The most common route is through the mouth or the nasal cavity. So either we inhale it or we take it in through drinking or eating. But there are other routes as well. The parenteral route is through our skin. So like if you have a bug bite, or you have a needle that you have to give yourself a shot and you don't clean your skin, anything through the skin, you fall and you scrape your skin off. I mean, that's the parenteral route, and that can cause an infection. And then you have the STDs, so sexually transmitted. The amount of the pathogen that causes the disease is known as the infectious dose. And that's important because different pathogens, when they get into your body through different routes, you may have to have more or less of the cells. And different types of bacteria also going through the same route can cause different types of problems. So here we have two different species. These are both gram-negative bacteria, Salmonella and Shigella, which we played with this semester. Salmonella, to cause us an infection, we need to have at least 1 million cells, whereas Shigella, you only need to have about 10 cells. So what that means is we would more likely be sick if we had Shigella bacteria on our food, because the likelihood of eating 10 cells versus eating 1 million cells, it's a lot easier to think that there could be, 10 bacterial cells on your hamburger versus 1 million bacterial cells on your hamburger because you didn't cook it effectively enough. And I'm using hamburger. I mean, this can be anything. I always think when you think of salmonella, you think of cookouts and stuff like that. That's my first thought. Now everybody's going to go home and be like, I don't want to eat cookout food anymore. And so what does that mean? That means Shigella actually is much more virulent than Salmonella. So once the pathogens get into our body, then they're going to start trying to replicate. So if they want to replicate, they first have to get attached to our cells and either get inside our cells or just hold on to our cells. And so they have different mechanisms. Bacteria have flagella that help them to move so they can get onto or into our cells. They have pili that allow them to attach. They have capsules that protect them from our own immune system. And once they attach, they then can trick our cells oftentimes into allowing entry. And so this is one mechanism that our cells use to get into the body from like the digestive tract, is they trick our macrophages into taking them in via phagocytosis. But the capsule protects them so they're not damaged, and then they can leave. And they're in the blood now. Once they're in our blood, they can replicate. They'll start, replicating and moving from cell to cell, doing whatever job they're going to do, right? But these bacteria, it's not just about so bacteria aren't evil. They don't want to kill us. They don't care about us. I mean, they care about us as much as we care about the earth. We want the earth to sustain us. We want to be able to live here. But most humans aren't going to go out of their way to take care of the earth. Bacteria are the same way. They're inside of us. They want us to survive because they're living in us. And if we die, then their home is dead, and then they're probably going to die too. And so that's a bad thing. But that doesn't mean they're going to stop replicating or producing waste products. And a lot of times pathogens, they release chemicals that cause disease, not because they want to cause disease, but because it's part of their metabolic breakdown. It's just releasing waste. And some pathogens also have enzymes that protect them from our immune system. So when our immune system does start to try and attack, these enzymes help them either to evade the immune system or to be able to use the immune system for their own benefit. So gram-positive bacteria have special type of toxins called exotoxins. Exotoxins are released from the cell and through exocytosis. And when they enter the blood, they can cause all kinds of different types of problems depending on the type of toxin it is. So cytotoxins are chemicals or toxins that attack and kill off cells, different types of cells. Neurotoxins attack the nervous system, and enterotoxins attack your gastrointestinal tract. All of these toxins are produced by gram-positive bacteria. In fact, exotoxins can only be produced by, no, I don't want to say that. Exotoxins can be produced by gram-negatives, but not as often. More gram-positives produce exotoxins than gram-negatives. These toxins are proteins, and they're produced as part of the regular bacterial metabolism. So it's not because the bacteria are trying to hurt you at all. Endotoxins then are released by only gram-negative bacteria, because endotoxins are part of the gram-negative bacterial cell wall. Remember that lipopolysaccharide that we talked about back in chapter, 3, I think, 3 or 4, that we find on gram-negative bacteria. We have that lipid A and then that O polysaccharide chain. It's that lipid A that is the endotoxin. And so when that is released, it's released only upon death of the bacterial cell. And it always produces the same response. So when a gram-negative bacteria release these endotoxins, they cause our body temperature to increase. these endotoxins actually move to our hypothalamus and set our hypothalamus at a higher temperature, causing us to have a body temperature that is higher than normal. And so this can cause, or this can lead to a positive feedback of increased temperature that can lead to endotoxic shock. And that's super serious, not a good thing to have. Feel like that shouldn't be at 15 minutes. I don't think I've been talking that long, but that's okay. So once pathogens have gotten into us, then they have to be able to get out of us. And pathogens typically take their same route that they came in to get out. So if they went in through the oral fecal route, they're going to leave that same route. They went in through exhalation route, they're going to leave through that same route. All right, hold on one second.